Oh, hi, everyone.
Hi.
All right, we are live. It is a great night here on Shepherd. We're so excited to learn about acupuncture. Thank you so much for being with us.
It's wonderful to be here. Thank you for this opportunity.
And you are local. Okay, let's see. Where's your office? You are mid cities.
Well, I'm in Grapevine.
Yes. Okay. I'm
Yes.
going to consider that like middle. That's perfect. Close
Okay.
to
Yeah,
both
I
Fort Worth
wasn't
and
sure which
Dallas.
box to,
Yeah.
to fit in.
It's great
Grapevine.
to have you. We're so excited. Acupuncture is something kind of, I feel like, difficult because it's not in everybody's thought process. I mean, it's difficult for me to wrap my brain around. I was raised with traditional Western medicine, then learned about supplements, but oils are frequency, grounding obviously is electrical. Our whole bodies are an electrical system.
Yes. Yes.
So it makes sense in a way. I'm excited to have you explain so we can really understand, what's going on, how can acupuncture help kids. Just really excited about that. But tell us a little bit about you. I know you're a longtime resident of the area, right?
Yeah, I'm a native Texan. I actually grew up in the New Braunfels area. Um,
Oh,
and then I married somebody from Atlanta. So I lived in Atlanta for 20 years and then came back here to Austin and then moved up here about 2.5 to 3 years ago because of a grandbaby. My older
oh,
daughter
wonderful.
and her family, her husband started their family. And so that's why I'm here. But this was a great move anyway for acupuncture because there's a big fifth ranked in the nation school, acupuncture school in Austin. So there's a lot of acupuncturists in Austin, but there are not as many acupuncturists here. So this area needs more acupuncture anyway. So it fits that need as well. So turned out.
Well, yeah, I thank you that you invited me to your clinic. You have a beautiful clinic
Thank
and you took care of my little one and me just so we could experience your work. And it really didn't hurt, just so everybody knows. You can
address
feel it.
that. Yes.
You can feel it. But my 12-year-old was not scared. Um, she was able to tolerate it. And we did see a relief in congestion after the treatment. So I thank you for that. I can just testify now that it's real, it's doable for kids, and it helps. So I appreciate you giving me that opportunity. Yes, when we met at the Love to Mama postpartum workshop, that's
Yes.
where we met, and we knew we wanted to get you on. Dr. Nadu was there and met you and requested more information, and I
Lovely
appreciate you
person.
being here.
Thank you. I'm honored to be able to chat with y'all.
Awesome. So tell us about your family. You have a new grandbaby?
I do. So I have three kids. My oldest is the one that has given me the grandbaby. She, of course, she lives in this area. She has a PhD in immunology from Baylor University, and she does cancer research. And then her husband is an OT who works with eye diseases and brain injured children and stuff. So they both have these really
Oh,
intense jobs. So I moved up, and the first year that I was here, I held off in opening my clinic until he was a year old, so I could be the primary caregiver for him Monday through Thursday, and then his dad took off Fridays. So I just I wanted to be right there on the ground floor with him. And then so that's my older daughter and her husband, lovely people. They just moved to Aledo because they both work in Fort Worth. So
okay.
my middle son is he still lives with me. He's high functioning autistic. So I have a lot of personal experience with autism. He's 35 years old. So back when we were first discovering this developmental disability, not much was known. I mean, it was not a household word. So he was kind of
Wow.
my full time job for about 5 years, and I learned a lot from all my kids. But he's working full time at Home Depot, very happy, wonderful, wonderful person. And then my younger daughter, is she's a neurologist. She's in Denver. She's the chief resident this year, and she's just finishing her residency program. And she's doing a fellowship next year in MS and other
Wow.
kind of more rare diseases that are autoimmune centric for neurology. So I call her all the time when I have neurological cases that are really complex and say, you know, why is this happening? What do you think about this? But
That's so
anyway,
nice.
I have to say she's the most altruistic person I know, and that's partly because of having a brother with autism. He's been a blessing in my family, a blessing. All three of my kids have been. So I obviously am a very happy mama.
Yes. Well, that's wonderful. Well, I know you have a presentation. We will have more joining, and certainly this is recorded, and everyone can watch it at any time, which is kind of the shepherd favorite around here, is being able to watch things later and at night and when the baby's asleep. So we look forward to having more join us. But feel free. Let's go ahead and get started. I'm excited.
All right. There we go.
Perfect. Wonderful. I can see it and I can see you. Thank you.
Perfect. All right. Well, welcome to my talk. I'm very excited and honored to be here talking about this really important topic. So we'll discuss in detail what is acupuncture and how can it help kids. So my name, as you know, Becky Upchurch. My practice is called Mindful Spirit Acupuncture. I'm licensed in the state of Texas. And here we go. So a little bit about my background. I already mentioned I am a native Texan. And, you know, at my core, I'm a mathematician and a healer. I'm a problem solver. And so those pieces have always driven what I've done in my life. Sometimes more one, sometimes more the other. But I started off, went to University of Texas at Austin and got a math degree, and started working as an actuary. Got my associates in the Society of Actuaries. While I was working full time as an actuary, I also met an actuary and married an actuary. He's the father of my three kids. So we were like totally, and I was a marathoner. We were totally in a non-kid kind of world, very nerdy. And then we decided,
that's kind of a nerdy couple there, Becky. No offense.
but so we decided to start our family. And when I was pregnant with Casey, my older daughter, I had made the decision within myself that, you know, I was going to take 18 months off and just be with her and then jump right back into it. Well, let me tell you, I fell head over heels in love. And those 18 months turned into 13 years. And in fact, my son, Christopher, was the only one that was actually really planned. And it's because if I don't have another baby soon, I'm going to ruin my older daughter's life because I'm going to smother her because she was my world, right? So then, and as I said, he has autism, and that's been very interesting. And being a stay-at-home mom and spending all that time, that was a luxury and a blessing to be able to dedicate that much time to working with him, finding services for him. We were living in Atlanta at the time, and there are a lot of services that are still there helping children with autism and other developmental disabilities that we brought to the area. So, and then, so I was a stay-at-home mom for 13 years and had the three kids. And then I went to Georgia Tech for grad school and got a master's in math and then a master's in electrical engineering. Moved back to Texas, to Austin, and worked at the University of Texas Applied Research Lab as a research scientist. Did a number of research science jobs and then moved into data science. The tools for both of these fields overlap quite a bit. It's a lot of it's problem solving. It's a lot of like predictive analytics and mathematical modeling and machine learning algorithms to solve problems. So and I loved that work. But I felt like I wasn't using this other really big piece of me, which is that healing piece. So, and also the work environment was, a little bit, it's a little hard, it's not a healing environment. And so I was talking to a good friend of mine one day, and I said, how do I balance this? And she was like, well, if you could start all over, what would you do? And I said, I would go to medical school. My younger daughter had just started medical school, and it was kind of on my mind. I had no idea that was going to pop out. But she said, there's more than one kind of medical school. And I was like, oh, I mean, and that was my beginning about acupuncture. I didn't really know much about it. And just to your point that you were speaking to earlier, in our chit chat, it's like it wasn't something that I just grew up hearing about. So anyway, went to acupuncture school. Just so happened, fifth ranked school in the nation was in Austin. So went there. It's a 4-year program. It's a master's degree, 4 years. It is medical school. It was way more intense than my graduate studies at Georgia Tech. I have to tell you, a lot of memorization and a lot of being tested. And then when you get out, you're not licensed until you pass these 4 boards. They're national boards, but the state of Texas licenses us through the Texas Medical Board. So there's an acupuncture board, a biomedical board. There's a lot of biomedical classes too, and an herbal medicine board and foundations of Chinese medicine. So my practice is called Mindful Spirit Acupuncture, and a lot of my practice right now is adults. Okay. I am growing my pediatric practice, and I have a lot of experience with pediatrics, but I think the people in general, that's a little bit, not a lot of, even fewer people know about acupuncture for pediatrics than for adults. So, but in my adult practice, I treat everything from anxiety and allergies to eye diseases to pain to Parkinson's. I've treated such a wide variety, it's hard to even couch. I also have a growing practice in fertility, pregnancy, labor, and postpartum, and that's also very near and dear to my heart.
Wow, it must be an exciting day at the office. You never know what you're going to get.
I never
variety.
That is, I always have people do their patient intake before I ever see them, because like I said, like you said, I never know what's going to come. And I want to be sure that not only do I, kind of have a little bit more of an idea what they're going to come in with, but I'm very into research. So I do evidence-based, research to make sure I am doing everything that's currently known about that disorder that I can help them with.
Yeah, so we do the pre intake paperwork at Shine as well. It makes such a difference to really understand what they've already done, what they're going through, to help you be thorough. So we appreciate that for sure.
Yes, thank you. And I mean, I've heard people say, "Oh, most doctors don't read these things," but like y'all do and we do. It's important. So I want to start with talking a little bit about some background. The language is a little different for acupuncture somewhat, and I'm not gonna do too much of that, but I do want to mention qi, because qi is very difficult to explain, but it's energy, it's our life force, and it's something that we work with, we manipulate, even if you can't see it, and sometimes you can see it in acupuncture. So this is a quote by Giovanni Macchiota. He wrote the book, The Foundations of Chinese Medicine, and it says, "Qi is the root of all human being. It is the basis of all phenomena in the universe." So it kind of is sort of everything. And the mind and the body work best when our energy flow, our qi, is in balance. So acupuncture is going to be about putting the balance back in the body. And as we know, there are a lot of things that affect that balance. These are things y'all work with all the time: the environmental factors, lifestyle choices, congenital and genetic factors, emotional factors, and stress. All of these create blockages in this free flow of qi energy. And these blockages lead to stagnation, and that is actually what is causing the pain and the dysfunction in the energy channels in our body. So you can think of these blockages like traffic. Sometimes traffic's flowing freely and, We're not even thinking about it. We're just going about our day and life is good. But then other times it slows down and it's sluggish and we can still get there, but not very efficiently. Or there's this traffic jam, like this picture on the bottom here. And that's when things really break down in the body. And that's when we're really feeling that pain, or we can't do the things that we love. It affects our daily living skills and so forth. That's when things get so clogged up that there's stagnation. So we have these body meridians. They're all connected. You can see there's no breaks in any of these lines. We have interconnecting energy channels all over our body, including our scalp, our face, our feet, underneath the feet, the toes, fingernails, well, not fingernails, but fingertips. And so these channels pass through our organs and every system in our body. And they contain thousands of acupuncture points that all have their own energetics and their own healing properties, and combinations of these points are powerful as well. So we've all seen this symbol, a little Tai Chi symbol. Yeah, balance. Okay. So balance of yin and yang, upper body and lower body, proximal and distal energy distribution, channel energy distribution, those channels I talked about. We get rid of the excesses and the deficiencies, and you can have both in the same body in different channels. But we're going to talk more about this balance and all of these concepts as I go along. So now that's a little background. What is acupuncture? So when our body's disrupted by these external forces, disease, even emotional imbalance, acupuncture helps to restore the normal flow of energy. The body wants to be in balance. And so acupuncture can, helps to restore that balance. So acupuncture activates the body's innate healing potential, restoring the balance, maintaining health. So even if you're already healthy, it can help maintain that. And it supports the overall well-being, both physically and emotionally. So another cool thing I love about needles, every needles are actually kind of cool. They really are. Every single needle releases endorphins. So I have people who fall asleep on my table all the time because they're so relaxed. And I'm not even done putting needles in when they do that oftentimes. So it releases endorphins, which are those feel-good hormones. It boosts the immune system. It increases blood flow to the area. So just right off the bat, it's going to help with high blood pressure because it's increasing the blood flow to the area. And, like I said, the body wants to be in balance, but life happens. And so acupuncture helps with that. By the way, this picture on the very bottom of these three, that's my neurologist daughter.
Oh,
she's my model for my website. I'm doing a facial rejuvenation treatment on her, which she doesn't need, but she's like, yeah, I want that. So that's what I did.
That's awesome.
So one thing I really want to emphasize, acupuncture is more than just needles. So if I really have somebody who says, and I've had this before, I cannot handle needles, I really can't, but I know that you can help me. What can you do instead? There's a lot we can do. And also, I don't use needles on babies. They don't even need it. They heal so quickly. Acupressure works on them. But let's talk about these other modalities. I just want to mention them. So acupressure is touch on the acupoints. Cupping, there's a ton of different kinds of cupping. This picture here has some red light therapy in the cupping as well. So it's kind of doing two things at once, but there's lots of kinds of cupping. Gua sha is that picture on the bottom right. That's kind of a scraping over of like a really tight muscle. Feels very good to have this gua sha tool, and it breaks up the stagnation that's kind of more superficially in the muscle tissue. Tui na is the picture on the left, although that might also be acupressure as well. Tui na is massage along the channels. So it's a very specific kind of massage, and that's also what we use on babies as well. There's also this thing called frequency-specific microcurrent, which I don't really have time to talk about, but that's available too, and it's not needles.
Hey, we've got a question in the chat, if you don't mind. And if you're going to get to this, that's okay too. But one thing we do at Shine is recommend mudding. It's literally mud that we put on vaccine sites. And they talk about how mudding reconnects the meridians after injury to a site. And are you going to talk about how vaccines, how they affect energy flow? Any research done on
Not
acupuncture to
specifically,
restore?
not specifically, but we do have points that are specifically meant for vaccine injury, and sometimes, and also like for uh, allergic reaction to like injections, not just
Mm-hmm.
vaccine injections, but like like a patient came in with injections for her Crohn's disease, and she just had just horrible pain in all her joints and all over her body. And we have an acupuncture protocol treatment. It's needles, but there's also herbal medicine and the mudding. I have actually not heard that. That's very cool. But I can see how it would help in part because there's so many things that are it's an it's an immune system thing, like, so my daughter's
Mm-hmm.
the immunologist, right? And one of the things she did when she was pregnant was to get a cat, so her baby wouldn't grow up to be allergic to cats. And so it's like, and you hear about this with honey, that it not for babies, but I mean that the kind of honey for the area helps to with autoimmune function.
Mm-hmm.
So I can see how it would help with that. We have a lot of topical herbal medicine that has Chinese herbs that are very soothing, and they have actions specifically for the cause that we're working on them with. So for example, I treat a lot of psoriasis and eczema, and we have awesome topicals that help with that. So
Awesome. Is there a tip or just so much that you learned about the body and the meridians that you could say, hey, if you gave an injection here, or you could measure somewhere, this wouldn't be as disruptive to the energy? Or is it not really about the puncture of the vaccine? It's more about what you're inserting. What do you think
yeah,
about that idea?
I think it's both. I think the bigger thing is what you're inserting, but I think so like this Crohn's disease patient,
Right.
she had the injection on her right side, her arm, I believe, and the right side was way worse than the left. The left was bad too, but the right side took the brunt of it. So I think where it's injected also makes a difference.
Interesting.
Yeah.
Okay.
So we also have light therapy. This is a Saluma light therapy over on the upper picture here, and vibrational energy. This unit is called rapid release. It's high frequency vibrational energy, and all these things help break up the stagnation, because remember, the stagnation in the energy in the channels and in the body causes the pain and causes the dysfunction. So, oh, and the herbal medicine picture at the bottom, two of those are, one of them, the one on the far right, Quiet Calm, that is specifically for children and as young as 2 weeks old. So, that there are companies that this Gentle Warrior is a line of children's herbal medicine, and they're tinctures. So,
That's cool. When you say stagnation, that makes me think of tumors.
yeah.
Um, is there much you can do to kind of energize that and for healing?
Yes. Now we do have to be careful to not tonify the tumor. So it depends if the cancer is not in remission. I mean, cancerous tumors, I don't usually work directly on those, but let's say like uh, like a boil, or I do work on
Hmm.
those kinds of things that are. I need to be really careful that I'm not going to create a growth environment for the tumor. You know what I mean? So cancer is a little different. We do treat
Okay.
cancer, and we treat the side effects of like cancer treatments and stuff like that too. But that's
Cool.
kind of a case by case basis. But yeah, so I do want to like beat the drums for needles. They are the most effective approach.
Yeah.
You need fewer treatments, and they sometimes it's just one treatment that's needed to take, especially pain. Pain's pretty easy to fix. And these needles, you can see me in this picture. That's my daughter again. You can't even see the needle. It's like hair thin, and they're meant to easily penetrate the skin. Some of them are even coated with silicone, so they glide in even easier. and most of the needles can't be felt at all. I have patients ask me, so how many, especially if it's their first time, how many needles did you put in? And I'll say, how many did you think? And it's always at the most a third of how many I've actually put in. So if
Huh.
that's a little reassuring, you know, and like
Yeah.
I said earlier, a lot of patients fall asleep while I'm needling. I also use electroacupuncture because this maximizes the effectiveness of the healing, because I'm attaching a little just mild electric current to the needles, and so it's allowing the needles to go further and go deeper and more, you know, just have more effect. And I also can pick the frequency that is the most specific for the healing that person needs. Like sometimes they just need more circulation in the area. Sometimes they have inflammation. You know, it just depends on, there's different frequencies that specialize for those different things. So, and I want to read this little quote. There's this wonderful book called Acupuncture for Babies, Children, and Teenagers by Dr. Rebecca Upchurch. And she says, the widely held perception that needles hurt and would be traumatic for a baby or young child is probably the biggest barrier to more children having acupuncture treatment in the West. So, you know, there's that. Okay, how can acupuncture help kids? This is my favorite part of the presentation. So this is my little grandson. Look how big he
Oh,
is.
he's so cute. I figured that was not a stock photo. That's a cutie pie right there.
Yeah, he's 2.5, and guess what his favorite thing is?
Fire trucks. What?
You got it. You got it.
I love it.
So this was taken just Saturday at the Peach Festival in Weatherford. It was so fun, and they had a fire truck there. He kept wanting to go back and see the fire truck. So his dad finally just put him on it and said, "Let's take some pictures." So we treat the different stages of childhood differently, and that makes sense, right? Because there's also different typical imbalances. In everything I'm going to talk about, it's all about an imbalance that occurs that we can treat. So how do they manifest differently for all these different categories of children? So first, babies and toddlers. So this is some acupressure, or you know, maybe the tuina, which is the massage along the channels. This point where I could get into detail, I won't. It's very hard for me not to talk about what they're doing in this picture, but okay.
Yeah. No,
So
I'm curious.
okay, so our the channel that governs our birth, growth, reproduction, aging, our kind of essence and kind of our sense of ourself, that's the kidney channel. And the kidney channel starts on the bottom of the foot. So this is probably a baby having some kind of failure to thrive or some kind of problem like that related to that channel's duties, and there's deficiency in that channel. And so, you know, this is massaging on that kidney 1 point. And then we'll get into, I think in the next slide, I'll talk a little bit more about some of the common conditions that I see with this population.
Wow.
So
So is that something that one of our parents could bring the baby in to see you, and then you could show them how to continue to do that at home, or is it just one time needed?
absolutely, absolutely. And I even have a whole book on, you know, on Tuina, the massage along the channels for babies and children that I could let them borrow.
That's fantastic. You know, I mean, even just infant massage in general, we believe is so helpful, but how much better to get the details right on where
Yes,
to do this. That's great.
yes,
Thank you.
yes. And you know, just a little tip I can even say right now, you know, this population, this is actually my next slide, they tend to have deficiencies in the stomach channel and the lung channel because these are still developing. So even just taking, you know, just doing this circular motion on an infant's belly is helpful for their digestion. So you're basically going, you know, up the right side, over the top, and down the left side, and just kind of making this gentle circle. And you know, sometimes that's all it takes to soothe, you know, a little stomach ache. You know.
Up the right side, down the left side. That's kind of, I think that's what we say. It's like you're looking at a clock and the belly button's the middle.
Mm-hmm.
Okay, good. That's
Yeah,
encouragement for us too. That's what we
yeah,
have said
because
with
that's
that.
the energy flow in that area. You
Mm-hmm.
know? So, yeah.
Oh,
Um,
thank you.
Yeah. So when I talk about these channels and I mention things like lung, stomach, heart, liver. I'm not talking about the Western medicine concept of those things. There is a lot of overlap, but I mean the traditional Chinese medicine, like in this last bullet here, the heart and liver channels, those tend to have excesses in them, and they look like overactivity, like unable to like calm down, or sleep issues. So those are some common things in toddlers. And this, by the way, is my grandson again, Caspian. This is him again. So these are some common conditions that acupuncture can help with for this population. Colic, common colds, allergies, failure to thrive, of course, digestive and GI issues, food stagnation. Food stagnation doesn't mean there's like, you know, a clump of food somewhere in the stomach that's not getting digested. It's an energetic concept, but that is a very common thing that causes pain in babies. Diarrhea and constipation, rashes, insect bites, skin disharmonies. I've seen really severe eczema on a baby that's as young as this picture, and it's very sad. But there are some awesome topical pastes that traditional Chinese medicine herbs, that herbal formulas that are really effective for that. Hyperactivity and overstimulated, and of course, sleep issues. Sleep issues are always going to show up. That's my grandson again. So young children, these are some things that show up. All of those previous things can still show up with this population. Of course, we treat what walks in the door, but picky eaters, sometimes that's manifesting during this age. Emotional
You see
imbalance.
a lot of that, Becky,
Yeah.
all ages.
Yes.
Where they really just cannot put it in their mouth at one
Yes.
today, and it's just can't eat it. And it's such a strong aversion that any help we can get with those kiddos, because it's a real challenge.
Yeah. So for us, that's a spleen chi deficiency. So we build the spleen chi, and the body helps. The body helps with the imbalance on its own. And there also could be some, the heart and liver are kind of govern the emotions. So, if we see some of that, it's probably a little bit of liver chi stagnation. I have some case studies.
Oh, wonderful.
I'll get into that's kind of related to one of them that I have. But so that's an important thing to say about what a session looks like. Every person, I don't care what your age is, presents with something slightly different and unique to them. These imbalances don't all show up in the same way for everybody. And a stomach ache for one person, a different channel can be the primary one at fault than another one. But that's part of what we uncover in the first treatment of what's going on with this person or this kid, right? So some interesting things on there. A lot of these are kind of obvious, but late to toilet train, that's a kidney chi, deficiency, or tendency to bedwetting. It's amazing. Kids this young respond like this to acupuncture. And you don't have to deal with like years of bedwetting or, some kind of, medication that might have some side effects. I mean, we have some great remedies for these things.
Right.
So children and preteens, okay, anxiety starts coming in at this time. Poor vision, headaches and migraines, adult teeth slow to come in. That means something. A person having high expectations of themselves, that can be moderated. Growing pains, that's a common thing in this population. Injuries from sports, being very driven, or the opposite, headaches and migraines. These are all things acupuncture helps with. So my last category of kids, teens and adolescents. This is probably who I've seen the most of, and so many of them, even if the reason they come to me isn't anxiety and depression, sometimes it is, but they all have anxiety and depression. It is just really prominent in this population, and sleep issues, and they tend to come together. I've also had some, South Lake takes its sports seriously, and I finally fixed one 8th grader, and now it's catching on. It's like she didn't want to miss a day of her sports, and we got her over her runner's knee, and 90% of it in one treatment and the other 10% in the subsequent treatment, like about 5 days later.
Wow.
Back, she's completely well, and she's a star athlete. So that was fun to see. But it's because the younger you are, the faster you heal. It's just amazing. Acne, that's a big one in this category, and all skin disorders. And sometimes these really create hits on the self-esteem, and acupuncture can help with it. There's light therapy is really good for acne. Herbal medicine is good for acne, so it doesn't have to be. In fact, the underlying channel is the only thing that I would even need to needle, and I wouldn't even have to needle to help somebody with acne. So that's a really good population that would not have to have needles if they came to me. I would use all those other modalities.
Okay.
So gastrointestinal disorders, and a lot of these come in because of stress. And sometimes, a teenager just needs to come and have a stress and relaxation treatment, and acupuncture is really great for that too, because of all those endorphins that they put into the body. Headaches, migraines, and pain, and pain anywhere. I mean, acupuncture is so effective at taking away pain. Alopecia is something that I see in this age group, and even just a little bit older, and a lot of that comes from stress as well. Here's some other ones: late periods, heavy periods, or late onset even of menstruation, late puberty in boys. Again, appetite things, craving sugar and carbohydrates. We'll look a little bit more of a case about that, about what that is and why that could be. Chronic loose stools, dark circles under the eyes. That's another kidney channel sign, deficiency sign. And then any age, eye diseases. Acupuncture is amazing at helping with eye diseases. So for kids, that might be like nearsightedness or crossed eyes or strabismus. We can help with COVID, autism, and developmental disorders. And I've used this on my own son, and I've seen improvements right in front of my eyes on my own kid. And there's a lot of research being done right now on acupuncture for autism. So that's very fun for me to see.
Yeah. When you talk about eyes, I mean, we end up referring to vision therapy.
Yes.
They're not tracking well. The convergence is a problem. I mean, do you mind expanding on that a little bit about how you do that, or do you have more on that?
No, I can expand on that right now. So there are like 5 channels that go to the eyes. So some of the points that I do are distal points, but some of them are just close. So ironically, the stomach channel goes up to the eye. It actually starts right under the eye. I don't put needles in the eye, but might put them as close as like here. You've got this little notch right here. I do this point all the time. And it never has hurt anybody. And it doesn't seem to scare people. Like when I first was learning about, how close these points are to the eye, I was like, oh, I don't know if I'll ever be able to do that. And it's like, it's just not scary. But there are points right around here because of the channels that go there. There's a point that's right here. There's a channel that goes from this direction. And then there's 3 that are over here. And then there's a channel that comes down from over the scalp that goes right in here. In addition to that, I'm a big fan of scalp acupuncture. Our vision lines, there's this occipital ridge back here. Our vision lines are about 1 inch on either side from that and up. And you can even tap this. That's like acupressure on the vision lines, because, the occipital ridge is where vision, that controls the vision component in our brains. So those are the kinds of things that I would do. And then again, I kind of spoke to this earlier. I look at what's going on with this person, with this kid. What is the underlying weakness that is manifesting as that? And I'm betting it's, kidney chi deficiency, because that's birth, growth, reproduction. I mean, there's probably a weakness both in that channel and in the kidney chi not kind of making that channel do its job. Does that make sense?
Yeah.
Yeah. So another thing I wanted to kind of bring up is pre and post surgery. Sometimes surgery really is necessary, but we have amazing herbs that keep clotting from happening, and that also really, I don't know how to put it. I want to say put healing on steroids, but that doesn't seem to be the right thing to say. But, you know, that just really kickstart healing. I myself, a number of years ago, had I tore my meniscus, medial meniscus, and I had to have surgery just to repair it. And of course, they had me go into PT afterward. And my PT person kept saying, "What are you doing? You're healing so fast." And it was, I mean, they just were really amazed. And it was, I'm needling my, you know, I'm doing some needles around my knee, and I'm increasing the healing, you know, potential in the area. So, and sports injuries also, especially for kids, it's so fast, so fast, you know. UTIs, you know, people don't really think of acupuncture for that, but we also have a great herbal formula. I always have it on hand in my house, just, you know, any kind of UTI related thing.
Mm-hmm.
So, okay, so I've talked about a lot of things that
Mm-hmm.
acupuncture can help with. And you're probably thinking, yeah, that sounds too good to be true. Why does it work so well? How does it work? How does it unblock these stagnations, you know? And what does a session look like? So the underlying reason why it works so well and why it can treat so many things, for one thing, it's been around for 5,000 years. So it has evolved and been, you know, perfected over the thousands of years. So it's very time tested. But also the body is intricately connected by all these energy channels. So, you know, it's like, you know, the stomach doesn't just start and stop with the stomach and maybe the, you know, the large intestine, small. It's like the energy is connected all throughout. And so, you know, we grow up tending to think of the systems of our body as being separate and maybe only loosely connected, you know, organs and systems. But you know, this concept is missing that whole interconnectedness, and including our mind, the mind body. I mean, y'all talk about that in your practice. So I mean, I know I'm preaching to the choir about that, but this interconnectedness is at the root of Chinese medicine, and it's all about clearing the imbalances, you know, correct. The body wants to be in balance. So the first treatment includes an extra, you know, 30 to 45-minute patient intake. And that's when I do a deep dive into all these, you know, not just the patient's physical, but their emotional health. And I ask specific questions. And sometimes, you know, I'll see somebody look at me like, how did you know that? And it's like, because, you know, I didn't explain right then, but I'm thinking to myself, okay, they have a kidney channel deficiency, and I'm pretty sure they probably have this too, and this too, and this too, and this too, and they just haven't brought it up yet. And it's shocking how often that is the case. So, and sometimes there are people who have multiple channels that have problems, because if you let something go long enough, it's going to affect more channels because everything's, you know, interrelated. So, but anyway, all these questions help reveal these patterns that lead to the differential diagnoses that I come up with. And they're specific to the excesses and the deficiencies in these channel systems. And I do have some examples. This is kind of the beginning of one of my examples, but it also is the only example where I'm going to kind of deep dive just a little bit into this case.
Okay.
So in traditional Chinese medicine, there are 12 regular channels that we also call meridians. They're the same thing. And so there's 6 yin channels and 6 yang channels, and they partner up. And so that's one of the things that needs to be in balance in the body, the yin and the yang. So the spleen channel, my case I'm going to talk about is chronic stomach aches. So, and the diagnosis for that, traditional Chinese medicine, is spleen Qi deficiency for this case. So I want to kind of explain a little bit what is the spleen channel. And, you know, in Western medicine, the spleen doesn't play a very big role, and I don't even think it's all that well understood, right, what it does. But in traditional Chinese medicine, it's like huge. It's responsible for the transformation and transportation of food. And so its partner is the stomach channel, of course, but it also works with all the other yang channels because they're the action channels. So they're kind of, you know, the henchmen kind of doing the work that the spleen channel is sort of overseeing. But the spleen channel is, and all the channels have a lot of responsibility. Spleen channel's responsible for more than just digestion. it raises chi. So if you're like tired in the middle of the day, you have a spleen chi deficiency. That means your yang is not rising enough. You're not, you have low energy. So that's another thing the spleen channel is responsible for. It controls the four limbs. So if you have, it actually controls muscles in general. Muscle weakness, a tendency to cramp, that's spleen channel. Controls saliva. It opens into the mouth and it manifests in the lips and plays a crucial role in the production of blood because it's the root of nutrition delivery to the blood. So this is an interesting thing. All the channels have an associated tendency, emotional tendency. And for the spleen, it's worry. And that makes sense because when we get worried, what happens? We get worried enough, we start getting stomach aches and stuff, right? Or we lose our appetite. It's associated taste to sweet. That makes sense too. When we are feeling really tired or, we tend to crave carbohydrates. And so when you see that condition in, one of those age groups about, craving sweets and carbohydrates, look to the spleen channel and see if there's a deficiency in that. So here's some spleen chi deficiency things that can come up that are not obvious. Excessive saliva, easily tired because spleen raises the chi, dry or cracked lips because the spleen opens to the mouth, tendency to have loose stools, digestive systems, that kind of makes sense. Lack of strength and control of the limbs, we spoke to that. Being clingy and whiny, having problems with eating and appetite, of course, picky eater, reluctant to try new foods, all those are kind of related. I mean, they may manifest some, maybe they don't all manifest in the same person is what I'm saying, but they all have a common underlying weakness in the body, imbalance in the body. Easy bruising, that's a little harder to explain, but that's another spleen thing. And tends to, I talked about that, tends to be tearful, emotional, sensitive, easily upset, and sleep problems due to worry. Sleep problems can be any channel. It depends on, do you have trouble going to sleep? Do you have trouble staying asleep? Is your mind racing? That's a different thing from, are you worried about something? Those are some of the things that we ask when we're, in that first session. And we can always talk about things. Like I always ask for updates. And if we need to spend more time talking about the update, even if it's not the first session, we do. So I just want to put that out there too. So here's the actual case. It's a 12-year-old girl. She was studying for entrance exams for her secondary school, and she came for treatment. This is actually a case that I got from, it wasn't my personal case, but it's awesome. It just shows all this really well. It's very illustrative is what I'm trying to say. So she came for treatment to acupuncture for chronic stomach aches. She had also lost her appetite over the time that she was reviewing for her exams. And her spleen chi was being used to fuel all the studying she was doing. And then the worry about the exams was further depleting the spleen chi. And so consequently, there was less chi available for it to maintain healthy digestive function. So you can kind of see how it gets piled on and piled on and piled on. And eventually it's so bad, you're seeking treatment because you've got chronic stomach aches. This is a picture here of the stomach meridian and the spleen meridian. And you can kind of see the spleen meridian. They both go through the stomach, of course, and they both go through the spleen. The spleen meridian also goes through the heart, and it opens into the mouth, as you can see there. So helps us with these clues that come up. The next case is anxiety and fear. This diagnosis, TCM, is kidney chi deficiency. And I kind of mentioned this already earlier. The kidney chi is our essence, our sense of ourself. It's our life force. It's our basic instinct to survive. It's responsible for life, death, aging, that whole, our essence. Okay, this is the kidney channel in this picture. You see how that point on the bottom of the foot, it's kidney 1 that was being kind of rubbed on that little baby to help tonify her kidney channel. So there was a 9-year-old girl who became very anxious, and she had developed problems going to sleep on her own since learning about World War II at school. She began dreaming about being separated from her family and taken to a concentration camp. And her mother did not think that any of the other children in the class had reacted in a similar way. So it wasn't like this this, strong, over the top thing was happening in the class. It was the girls. So the girl is exceptionally bright and was also rather physically delicate. That's a kidney chi deficiency thing. And so, her kidney chi was deficient, and therefore she was more susceptible than her classmates to being disturbed in this way. Also, kidney, by the way, its emotion is fear that it's associated with. So that's, that's kidney channel. So we tonified and balanced her kidney meridians, and it solved the problem. Solved her anxiety and sleep disturbances. And like I said, kids respond so quickly. Something that you think is going to take a year or 6 months, and it just clears right up.
Now, when you tonify the kidney meridian, does that tend to last? I mean, how long does it take to do that? And do they relapse if there's another severe event?
That is a really great question. And so the younger you are, the less likely it's going to relapse. So this is a great example to answer that question from, because she was exposed to something that kicked up this, the anxiety and fear response in her, and her kidney chi was already susceptible. And so it's manifesting like this. So this kind of thing clears right out. I mean, she's also probably talking about it to her mom and stuff like, it's like, right. It's not just what I'm doing, but, and everybody is kind of different. I know I keep answering that, but so part of it is, I know this resonates with y'all. Part of it is, the lifestyle choices. So if she continues to do things like watching scary movies or doing, just doing other things that are going to feed it, it is more likely to come back if the body keeps being exposed to the catalysts that cause the imbalances in the first place. Does that make sense? But, yeah. But usually and the other really important answer to this question is, how quickly do you catch it? If you catch it early on, it just clears up and goes away. This is the easiest to see in like an injury. So I've had a 72-year-old man walk in because 5 days ago he got out of his Jeep and he totally pulled his back out. And he is somebody who does everything himself. It's like he didn't even want to go to a doctor. He just happened to drive by and see my sign and got tired of having his back pain. I fixed it in one treatment. I mean, to be honest, was surprised because he's 72, but he came quickly enough. I mean, he came within a week of the injury, and, and he got off the table, and I mean, he was pretty shocked that his pain was not just kind of gone, 100% gone. And so, I mean, I'm kind of saying, okay, great. I mean, that's great. But if it starts coming back at all, you come back to see me, because, that's asking for a lot for it to knock. And, about like a week or two later, he came back, because I said, even if it's 10%, come back and I'll nip it in the bud again, and it really won't come back. And that's exactly what happened. He came back and he said, and I said, oh, I was really concerned. Oh, is it really hurting again? He was like, no, but you told me come back if it even came back 10%. And I would say it's probably 5 to 10%. And here I am. And I was like, yes.
It's nice when you get to see the success of the effort.
But it's amazing how often I see that. I mean, and for him, I did a distal treatment and a local treatment, but I'm treating a guy right now for hair restoration, and he really messed up his knee big time. So we're doing, he's kind of leaning up and his legs are straight on the table, the bed table thing that I have. And he also has back pain and neck pain and shoulder pain. Well, I can't get to his back when he's in that position, or really his neck, because of his priority was the hair restoration. So I'm doing distal points, and they worked. And they worked, like one treatment for him. And it went, okay. He actually came back today, and they left for about a month. He didn't have him at all for about a month. He was bragging to everybody, guess what? And he was like, that's great for my business, Yeah. But he came back today and said, starting to come back just a little bit, the back pain and the neck pain. So let's pay attention to that a little bit, as well as all this other stuff. So the answer, really, to answer your question, is everybody is a little different, but the sooner you get treatment, the more solidly it can fix the imbalance. And also, the younger you are, the body, young bodies just heal a lot faster. And this, they have fewer stagnations to have to work with. You know, by the time you're like 72 years old, you potentially have a lot of stagnations. You know, your body's got a lot of things it's dealing with, but you're so used to it, you don't notice it, or it's not enough of a problem to go seek some kind of treatment for it. You know?
No, I hate to throw you off, but I have another question. I'm thinking
Yes.
about the flow and the balance, and I'm thinking about a child that I know had a pretty significant fall,
Yes.
like 8 or 10 feet, essentially just a drop on the floor, and you think about the bottom hitting the floor.
Yeah.
Is that some, I mean,
Oh
it seems
yeah.
obvious now hearing your presentation, but it didn't really occur to me before how much that would disrupt the energy and cause all
Oh
kinds
yeah.
of problems.
Oh yeah. One of my patients right now, she's about 22. She has cauda equina, and she had had it for almost a year when she came to me. And you know what that is, right? You can't feel anything. It's called like saddle, neuropathy. Like they can't feel anything in the area of their body that would be sitting on a saddle if they were sitting on the
Yes,
floor, which
okay.
means there's no control over your urine and your bowels. And she just was wearing these pads and just trying to do it. And she couldn't feel anything in there. And I mean, I worked with her probably 3 months. Every time she came, she made more progress, more progress, more progress. And then, about a month into it, she started complaining that, like she could feel the needles and she didn't like that. And
Oh,
but yes,
wow.
you can feel them. But anyway, she's almost fully recovered now. And she's just got some little bladder related things just from having it for so long, like bladder control things. That's really the only thing she has left. She can feel everything. So, and she's not even, like a young child, but yeah, you have anything that is creating that kind of, what's the word I'm looking for? Kind of almost trauma to the body, a
Mhm.
type of trauma to the body. It's disrupting all kinds of stuff, and the body tries to recover. So to some extent, the body probably did, but to the extent to where she still has injuries, that's where it didn't, you know?
Fascinating. It's just another way to look at this. Yes. Thank you.
Yeah. And, I do also want to say I'm a problem solver. I mean,
Hmm.
like there are so many things that can be done. I even talked about all those modalities and stuff, but even just herbal medicine. I mean, so you could, if you combine herbal medicine with acupuncture, you're treating the outside in and the inside out, and you're making even faster progress. Um, so, so I think this is my second to the last case, but this is ADD, which a lot of people wouldn't associate with acupuncture being able to help. But a little background on this one, this particular case is a diagnosis of liver, qi, and blood deficiency. So when I say blood deficiency, I don't mean that there's not enough blood. I mean that it's not flowing. Like, think of like the traffic jam. There's the traffic's not getting through, so there's a deficiency of traffic, if you will. If the flow is not, so chi moves everything, including blood. Blood is in traditional Chinese medicine is a substance, and the blood and the chi moves it. So anyway, so blood deficiency doesn't mean you don't have enough blood. It is one of our diagnoses. And it kind of, I don't want to bog down too much about that, but I don't want to alarm somebody thinking, oh, you're telling me my child doesn't have enough blood. That's not at all what I'm saying. Okay. But the liver, qi, and blood house the emotional balance, and it's called the hun in traditional Chinese medicine. And this contributes to not having peaceful sleep, being disturbed by bad dreams. And when the hun is balanced, when the liver channel is, it's responsible for that, it allows a child to explore the imaginary realm, which is all perfectly healthy and normal, to explore that, but then to come back into the real world easily. So ADD in traditional Chinese medicine is a result of unrooted hun caused by the liver, qi, and blood deficiency. So the liver's not rooted. the liver, chi, and blood are not rooted, and so they can't pull it back, easily. And so they kind of, so ADD, they're kind of staying in the world of, they're not attending. Well, there's lots of
Right.
ADD shows up. But anyway, so here's an 8-year-old diagnosed with ADD. Her mother described her daughter as often living in her imaginary world. She struggled to follow instructions or commit herself to a task that she was asked to do at school, and she was not a defiant person. We nourished her liver, chi, and blood with acupuncture, and we talked to her mother about her diet, and that made a big difference to her. So she retained her wonderful imagination, but now she has more control over when she indulges it. So this picture, there's the liver channel, and then the picture on the right. These are some of the things the liver channel and the liver chi is responsible for in Chinese medicine. The eyes, you know, um,
Hmm.
the ability to goal set, the nails, menstruation, sinews, so the tendons. It ensures the smooth flow of chi. So those are all. So like stress is liver chi stagnation, and that's what it feels like. It feels like our emotions are like stagnant. That okay,
Wow.
yeah. And this is my last case. So this is an
Hmm.
infant. So they had abdominal pain, and the diagnosis was spleen and stomach chi deficiency with an underlying kidney chi deficiency. So this is a 2-week-old female. She was born at 6 pounds, 19 inches. The delivery was normal. And she was presenting with abdominal pain and digestive difficulty. And this is what it looked like for her. She would curl into a ball as if her stomach hurt, usually once per day for up to 3 hours. And they had, tried to solve it. They'd already tried to find solutions for it, but nothing was really working. So they came to acupuncture. The mother does have a history of chronic irritable bowel syndrome. So there's a hereditary component potentially there. And the palpation of the child's abdomen was very tense. So the treatment was Tui Na, which is that massage, mild acupressure and massage along the channels, and particularly for this case, along the spleen meridian and the kidney meridian as well. So after the first treatment, the parents reported that the child was without pain symptoms for 5 days. This fits into that question you asked a little bit earlier, Christine, about how long, but that pain didn't come back. What did come back was at the second treatment, she had a slightly flushed face with small red dots and restlessness and irritability. So that means that she's well, I guess she still did have a little spleen and underlying chi deficiency, but now she's got a slight heat condition on top of it. So the treatment was adjusted and this dissipated. And then constipation appeared in the third week, followed by occasional diarrhea, which is a sign of cold in the abdomen for us. And just an herbal remedy was added to the treatment, and it was just a scallion and ginger based thing, herbal remedy, and it dispelled the cold and made that go away. So the child likely inherited this spleen and stomach weakness, necessitating a constitution strengthening program as well. And after several weeks without symptoms or without additional treatment, the emphasis was placed on the breastfeeding mother's understanding of the energetics of food so that it could keep it from coming back. But one of the things this example shows is how quickly symptoms change in babies and children. The younger you are, you can kind of, especially one with some kidney chi deficiency, they're going to be a little bit more at risk for imbalances to happen, like preemies. You can see that in preemies.
Right.
Yeah. So, okay, I'm probably getting close to, I don't know what time it is at all, but I do want to say acupuncture is amazing for adults. And
Okay.
I treat everything, any kind of pain for one thing, also infertility, pregnancy, labor, postpartum, weight loss, eye diseases, such as macular degeneration. I have one patient who went from, she's macular degeneration, went to the Dallas retina specialist for 20 years. She's had it for a long time. And they have tried to keep it from getting worse, but they can't restore her vision. She started coming to me. She went from, it sounds like I'm making this up because it's almost just too amazing to believe. She started, and this is their test. She's telling me what I have an eye chart and I do that too, but it carries more weight if the retina specialist is doing their own tests. She started at 2070 vision. She's now at 2025. The Dallas retina specialists have documented her at 2025. And, she doesn't look out of the corner of her eye anymore. I mean, it's just amazing. I remember the first time she could actually see my features and she was like, whoa, I can see her eyes, And so anyway, it brings brings vision back. It recovers. So, and I can talk more about that, but also, cancer, Parkinson's, movement disorders, hypertension, addiction and smoking cessation, menopause. I see a lot of that. Night sweats or hot flashes, hair loss. I see a lot of that lately. I don't know why, but in women and men, that's really starting to I'm seeing a lot of that. Incontinence, eye twitches. I woke up with an eye twitch the other day and you put up with it for a while thinking it's going to just go away, right? And finally, what do? I Googled thinking I've got some kind of vitamin mineral, deficiency. What do I need to? And then I'm like, Becky, what are you doing? You're an acupuncturist. Let's see if you can make it go away with acupuncture. I just did here, and probably this one. Within 5 minutes, it was 90% gone. And within 10 minutes, totally gone, and it didn't come back. And I'm like, okay, that's really cool. But
nice.
So, and just all kinds of things. I mean, it's like I have never given up on treating anything. And I've seen severe Parkinson's and severe, neuropathy and just so the thing I want to leave you with is if you want to live longer in a healthier body, don't settle for feeling bad. Don't accept unnecessary limitations. Acupuncture can help.
That's fantastic. Okay. I know Dr. Nadeau had put a question out there and he's on too right now, but what kind of appointment times are available? I mean, we have a lot of athletes at Shine and, wanting to recover from an injury like you were talking about. Yes. Are you ever open on the weekends or in the evening?
I am. And yes, I am. So I love that this webinar is in the evening because I am not a morning person. And I actually do all my exercise. I'm an avid exerciser. I used to be a marathoner and it's like my day is not complete. So I do my, without exercise. So I do it in the morning. So my first appointments, and I do make exceptions if I have to, but I start at 11 o'clock in the morning, but I go until 8 o'clock and I'm willing to go later as well. I don't mind staying as late as I need to. I just am not crazy about, I don't like getting up before 8 o'clock and I do all my exercise. I exercise for an hour and a half every day. So I do that. And then I also want to get here with enough time to kind of get my head into, getting ready for my patients for the day. So my only days I'm closed are Sunday and Monday. And, but I'm open 11 o'clock until 8 o'clock every day except Friday. And that day, but I could make an exception as well. But right now on the books, it says till 6 o'clock. And I'm open right now from 11 o'clock to about 3 o'clock, I think, on Saturdays. But I also am willing to extend that. The reason I have that not longer right now is because I don't want somebody at 11 and then not another patient until 6 o'clock or something because it's my Saturday, So yeah. I sort of force them to kind of bunch together. And I've been in this, so I was in Austin. I didn't have my own clinic in Austin, but I was an acupuncturist in Austin before coming here. But when I opened here, it's been about a year and a half ago. So maybe not quite a year and a half ago. So I'm still growing my practice. So there's still lots of opportunity to get in right now. And this is my QR code. It takes you to the website and you can book online from this.
Wonderful.
Yeah.
You were extremely thorough. I appreciate that. I know you said that kids heal quickly. What about some of these older folks, like even with hair restoration, things like that? Is that just something like they need to plan on coming 3 times a week for a couple of months? I know you probably can't say. I'm just curious. Not that much.
No. I have a 90-year-old. He told me recently he plans to live to be 120, and he said, you are part of that solution. So, but he sees me. So he saw me. I don't think he ever saw me twice a week. Maybe the first week he saw me twice a
Okay.
week, and then he went to once a week. He had really bad back pain and kind of got this crick in his neck at one point. But and he had high blood pressure. He was very worried about his blood pressure. So within 2 weeks, his back pain was gone. The neck pain took a little longer, and I think part of it is how he's sleeping or what he's sleeping on. I mean, I think he keeps, again, it's lifestyle choices are coming into play, but it's so that we keep treating, but because it keeps coming back, but he probably sees me every 3 weeks, maybe once a month. But what I like to see, especially with older people, is twice a week until the treatment holds. You know what I mean? Because acupuncture is cumulative. I'm glad you asked this question because I didn't mention that. So the more you get it, the more, I mean, it's correcting the imbalances and it's putting energy in the body. I mean, it's unblocking the stagnations in the body, right? So other ones, it's kind of funny. There was a person who had a lot of different, she had a massive back injury and it was in a lot of places. And as I would fix one of the places, she wasn't feeling the other injured places before, but then she started feeling that and she was almost like accusing me of causing some additional pains that she didn't have before. But what really happened is she couldn't feel that because of the brain's paying attention to the most serious back injury that she had. And once we resolved that, these other things started kind of showing up. So I don't know that I answered your question all the way, but a lot depends on how what the health of the person is when they're not seeing me. Let's say I'm seeing somebody for what was the other thing you mentioned besides the back pain? Hair loss. Okay. Yeah. So I guess that's not a great example, but I do have a cute story about that. But let's say here's a pretty good example. I was seeing a patient with very severe ataxia. He was only 51 years old. A lot of scalp acupuncture for this. And I actually I took videos of him walking down the length of my hall and back before each treatment and after each treatment, so I could document the progress. And after he'd been coming to me, he did come for twice a week. I think maybe after the fourth treatment, he was doing so much better. And for the fifth treatment, he came in and he had like a gash over his forehead, and he just was skinned up everywhere. And of course, I thought, did I make him feel so good that he wasn't careful and he did too much and then he fell? And he was like, no. I mean, it turns out he's an alcoholic. So he's always going to be 2 steps forwards, 1 step back. You know what I mean? Mm-hmm. So our lifestyle choices matter a lot. And I don't usually press on that unless I can sense that the patient is open to that. So I do have some patients who come to me for weight loss, and they're very open to that. So, and acupuncture is very helpful for people who are ready to take. Addiction is also a great example of that. Addiction and smoking cessation. If they have to have their mind in the game too. And when they do, acupuncture just really helps with those things. In fact, acupuncture is so helpful for addiction that there's a protocol called NADA, N-A-D-A, stands for National Acupuncture Detox Association. This came about in like the late 70s, early 80s, because this was, research showed that it's just 5 acupuncture needles in the ear in specific places. And this was shown to be more effective than anything they had been doing in the inpatient or outpatient for addiction. And so this was adopted. In fact, the association, NADA, the treatment's called NADA as well, but the association, NADA, certifies people. You don't have to be an acupuncturist to do it. They certify like social workers and therapists and people who are treating addiction patients because it was seen to be so effective, and especially in conjunction with talk therapy. So hair, do you want to hear, do I have time to tell the hair restoration story?
Sure, if it's quick. I don't know, Dr. Nader, do you have a question?
Well, Dr. Upchurch, I want to ask you about the addiction um, protocol. What about when we have certain individuals who are maybe addicted to, like, obviously, sugars or carbohydrates are sometimes a big issue, but then also like cell phone use, um, addiction to like social media. Is there any place there for acupuncture?
I say yes. And so that's going to be kind of unique to each person and a little bit complex, but the things that hit me right off the bat, I there are points that help with um, like willpower and help with cravings and stuff like that. They're excellent at that. That's why they're effective for addiction. But then there's also, what's the underlying reason for that addiction? Like, is it like a self-esteem issue, or like an underlying, like kidney chi deficiency because they don't, it's a crutch for something else, or so so I would treat what I see besides that in that person, because that's going to help too. But yes, we have specific protocols that I'm gonna answer the question. I'm gonna switch to how I'm answering this because I feel like I'm bogging down. I have a patient who only sees me because when she sees me every week without failing. She's been seeing me for almost a year. And why is because she first started seeing me to help with her weight loss, and she was using pot too much. She wouldn't call herself addicted, but she felt like it was too much of a crutch. So I started working on that for her in particular, and she had an underlying kidney chi deficiency, and it manifested as willpower and the seeking the crutch. She she's one of my biggest fans. She's written one of my reviews or whatever, and she still sees me every week because I changed the direction of her life. I didn't just help. I mean, that she credits me with that. I didn't know I was doing that until she started talking about it. But she went from somebody with that was, escape seeking, didn't have goals, was in a dead end job, in tremendous amount of debt, in a dead end relationship, kept going back to the boyfriend, breaking up with him, going back, breaking up. She had some food addiction issues and low self-esteem, in part from this huge weight gain that she had done. And she credits me, my acupuncture, as taking her from that to uh, putting a purpose to her life, to it's hard to explain. She completely changed the direction of her life. Even she decided that she wanted to go to acupuncture school. She has also since gotten a specialization in the area that she was doing as a dead end job. Instead of being in a dead end job, she's now kind of a specialist in this niche of that area, and she wants to start a nonprofit. She wants to eventually be an acupuncturist. She started school. I mean, she just totally turned her life around, and now she refers people to me all the time because she just will say that acupuncture changed her life.
Mm-hmm.
So it's um,
So there's definitely a place for
yeah,
acupuncture in addiction
yes,
medicine. I know Dr. Lemke, she's out of Stanford. She's written a lot of literature on addiction, and so that's why I asked, because I've never thought about acupuncture in the role of addiction. So that is really good to know.
yeah.
Um, I know we're probably running short on time, but I have two more questions for you. One is on incisional neurotherapy. I know that, you know, with the meridians, I mean, things obviously get short circuited, and one of those things that can short circuit a meridian would be some type of incision, whether it's a surgical scar or whether it's some sort of laceration. Can you
Yes.
speak to that? Especially like I worry sometimes about our infants when we do these midline procedures with the laser, the frenulum, or the tongue tie. Is there
Yes.
anything that we need to be aware of in those procedures? And should children be getting some sort of like acupressure after going through those type of procedures?
I would say yes, because it's creating the definition of a stagnation, a break. It's
Right.
breaking those energy channels. And especially, you know, the, like that's the spleen channel that ends at the, root of the tongue and stuff. And so, yes, they need these surgeries, but, but yeah, acupressure for sure, and tuina, which is that massage along the channels, can help restore the energy flow. I mean, that energy pathway right there is severed, but energy doesn't. It can find a way around it, but it needs help.
Got it. Got it.
Yeah.
So that might be something that we really need to try to potentially incorporate, especially when we have a child who is not seeming to recover very well after these lip and tongue tie procedures. And I've seen that on several occasions. So I think that's something that we need to be mindful of. And then the last thing is I've always been big about my children. They talk to me a lot about tattoos, and I've never been a fan of them, but I know that it's becoming more and more popular in current day culture. Can you speak to what you know on the traditional Chinese medicine side of things about what the ink potentially does to our lines of meridian or acupuncture points with respect to tattoos?
Okay, so the good news about that is that the acupuncture meridians are deeper than that.
Okay,
We do have channels that are on the surface, our sinew channels. Those are our most superficial channels, but the deeper ones they're below that. So
good.
it's still a poison that's going in the body. And one of the things I recently heard from one of my patients is that they're finding, he's a researcher, he's a professor emeritus in public health.
Uh-huh.
And so he still stays, he still does research. And that's one of his areas that he is very upset by is the proliferation of tattoos and the damage it's doing. So he was telling me about studies that are showing that there's lead in that ink. Like not all of the, there is not a lot of oversight on the products that are
Yeah,
being
the
used.
regulation. Uh-huh. Right.
Yes. So that's a concern as well.
Okay.
Yeah. And one thing I want to say about the addiction thing, one little because this is kind of important. Every needle releases endorphins. And so sometimes that's what that person with the addiction is looking
Yeah.
for. So
Right.
that's another reason it's helpful.
Gotcha. Very good. Yeah, those are all my questions, Christine.
Awesome. Well, thank you so much. We appreciate you being here. We'll be sure to share your contact info and
Thank you.
get the word out. There's a lot of complicated cases at Shine, and we need all the tools we can get. So
I would love to help. Would love to help. I love children. I even have, I don't know if you'll be able to see it, but I have like these like dinosaurs that are big. Like one of them's 4 feet tall, 4.5 feet tall. And I have another one that's about 2.5 feet tall. And I have dinosaurs in every treatment room. That's my thing. My little mascot, my little mascot is a little dinosaur. He's a little Tyrannosaurus Rex. He's called Moxie. So
well, you're a lovely, kind person. I feel like we can trust our patients with you and they'll be comfortable in your office. So
thank
thank
you.
you.
Thank you
All
very
right,
much.
everybody out there, we appreciate you. And thank you, Becky. We appreciate you. Have a good
Thank,
night. Thanks for your
Thank you
time.
very much.
thank you, Dr. Upchurch.
Thank you.
Bye-bye.
Bye.